Hello, welcome to Health Talk. I'm Dr. Manny. More than 75% of adults in the U.S. have some form of gum disease, but these conditions are completely preventable. Now, joining me now is Pierre Blumenschein, CEO of Emmi-Tech, Inc., to talk about a new technology that is changing the way we care for our teeth. Thank you for being here.
Thanks.
As doctors, we keep talking about dental hygiene as being sort of one of the pillars that can prevent a lot of things from, heart attacks, inflammation in the arteries, miscarriages. So I'm very aware of that. Technology changes, but I've been told that you got the hottest thing on the market. The hottest. Tell me about the Emmi-dent ultrasonic toothbrush.
Yes, the Emmi-dent ultrasonic toothbrush is a new device in the United States. It's been available in Europe for quite some time, and it's the first toothbrush which runs 100% on ultrasound. So the ultrasound cleans. You do not have to brush. So it's a no brushing toothbrush.
I know that, technically when you go for a dental cleaning, there are devices that the dentists use which are ultrasonic in power, and that this way they're able to break the tartar. Is this the idea behind the technology?
It's basically the similar concept, although we use microwaves that have significantly less power, just enough to kill the bacteria in your mouth, in your gums, on the teeth, so that you don't destroy the teeth or the enamel, and basically don't harm your oral system.
So let me say, so if I was comparing, let's say, the typical run-of-the-mill toothbrush,
yes,
right, which is just a brush, and it's physical force, whether it goes like this, whether it goes in rotation. Your argument is that the sound waves or the ultrasonic waves are far superior.
Yes, they are far superior. You have to see two things. First of all other toothbrushes, you're basically scraping away the bacteria. Some of the bacteria resides on the bristles and comes back the next time you use. They are not really completely destroyed. With the ultrasound, you have so much energy that is basically destroying the membranes of the bacteria, and therefore they're completely destroyed and disappear with a mouth rinse, or just simply fall in thousands of small pieces. And that's the benefit of only ultrasound. So you must have an ultrasonic toothbrush with an ultrasonic chip, which is in our case of Emmi-dent, in the brush head, and then you can really kill the bacteria. And the ultrasound, the beauty of that, and this is why it's a superior system, it's penetrating the gums. It's not just cleaning where the bristles goes, but it really goes through the whole tissue. It cleans in gum pockets. And also, because it's the no brushing toothbrush, you don't have to move the brush head, you don't abrade, you don't destroy the enamel of your teeth.
What's the feedback and what kind of studies have been published? I mean, if I were to ask dentists,
yes,
and I'm sure that you didn't come up with this yourself, you probably had a lot of input from a lot of dental specialists, doctors. What's the feedback? What is the loop that we could tell people that? What studies have been done, and what is the dental community? How is the dental community receiving this?
Well, first of all, our company has done studies with several universities in Europe, and they have proven the results. The uptake from the dental community is great, because the studies confirm what we are saying, that we are reducing and killing bacteria dramatically in the mouth and on the teeth and the gum, etc. And the dentists love it, because they give it to even some of their patients which have problems that no other oral hygiene device can actually help them with. And they give Emmi-dent to those patients, and after 2, 3, 4, 5 days, these people obviously have less problems. In some cases, completely no problems. No inflammation, bad breath, tooth whitening, the stains disappear immediately after 2 or 3 days, so there are immediately visible benefits.
Any possible risk or side effects?
No side effects. The Emmi-dent is in use since 2004 in Europe, from thousands and tens of thousands of people. No side effects.
What about, now people have dental implants. Can it be used in all sorts of, oral cavities?
Definitely. The Emmi-dent ultrasound doesn't destroy the teeth, the gum. It doesn't destroy prosthetics or implants. It's actually helping them. It's kind of a protection insurance, because with implants or with prosthetics, bacteria can quickly hide, and we're taking those bacteria, kill them, and destroy them. So you really have a cleaner mouth.
What about children?
No problems with children. We even have a special children brush head, which is smaller, so they can enjoy it as well. And one of the things where we feel a lot of benefit for patients is the special brush head for braces. You can actually clean your braces even where you couldn't clean them because there's bacteria under the wire, and that's particularly for children, for parents caring about their children. That's perfect.
Now, I know a toy like this is a little expensive. How much is it?
The Emmi-dent is costing $189 US. You can get that on the Emmi-dent.com website, or you can ask your dentist.
And also, I guess a lot of dentists here in the U.S. are now utilizing this and are giving out to the patients. So, you know, you may want to talk to your dental specialist about that.
Yes.
All right. Well, it sounds good. I'm going to try it.
You should.
All right. I'll tell you how it feels in about 6 months. I'll get you back here.
You have immediate effects, I'm sure.
All right.
Thank you very much
Thank you very
for having
much.
us.